Hi, and welcome to the first video in a four-part webinar series on maternal health presented by Security Health Plan. Every person deserves a safe and supported pregnancy journey, but too often systemic barriers create disparities in care and outcomes. This mini-series is designed to inform, empower, and equip you with the knowledge and tools to navigate your pregnancy, understand your rights as a patient, and confidently advocate for yourself and your baby. Each video will explore key topics, break down complex issues, share practical guidance, and highlight the steps you can take to ensure you receive the care you deserve. No matter where you are in your journey, this series is here to help you feel informed, prepared, and empowered. It is common to have various reactions upon learning you're pregnant. There is no right or wrong. It is different for everyone. Some people do not have support systems in place to share knowledge and next steps after becoming pregnant. In this video segment, we will share steps you should take after confirming you're pregnant, regardless if you choose to carry to term. Let's get started. After confirming you are pregnant, either at the doctor's office or via multiple reliable at-home pregnancy tests, you should consider your options. Currently in Wisconsin, you have 20 weeks to decide if you want to continue your pregnancy or terminate. This time frame does not include if there is a threat to the life of the pregnant person. At that point, an abortion can be given by a physician at any point in the pregnancy. Be sure to stay up to date on state or federal changes to abortion access. Discuss your options with your provider and support people. There are affordable abortion options if that is what you choose. Be sure to research your family history. This can be important background information about hereditary conditions or defects that run in your family, such as Down syndrome or cerebral palsy. You'll also want to take time to learn about your work's parental or medical leave options. The Wisconsin Family and Medical Leave Act, or FMLA, does provide unpaid leave and ensures you won't lose your job while on leave. Since most people cannot afford to go on an extended unpaid leave, you may need to save PTO or apply for short-term disability benefits. Early into your pregnancy, you'll want to find a medical doctor who specializes in obstetrics gynecology, or an OB/GYN. You have the power to decide who you want on your care team. You will need to ensure they are within your insurance provider's network coverage. One easy way to do this is visit www.securityhealth.org. At the top of the page, select Find a Doctor or Facility. This will allow you to search within your network for specialties, doctors, and facilities. Once you have chosen your care team and provider, make your first prenatal appointment. You do not need a referral from your primary care provider to set up the initial appointment. That first prenatal appointment should take place in the first trimester, which is the first 12 weeks of pregnancy. You can expect your doctor to ask about your medical history, past pregnancies, family health history, and current medications. There will be a physical exam that may include checking your weight, blood pressure, and a pelvic exam. Blood and urine tests are done to check for conditions like anemia, infections, blood type, and pregnancy hormone levels. You'll get advice on what to eat and what to avoid. Your provider may discuss genetic screenings and other optional tests based on your health and family history. Your provider will discuss vaccines that are safe and recommended due to your immunocompromised state. That means your immune system's defenses are low, affecting your body's ability to fight infections and diseases. Depending on the timing, an ultrasound may confirm the pregnancy, check for a heartbeat, and estimate a due date. Now is a great time to ask about your symptoms, lifestyle adjustments, or any concerns that you may have. This appointment lays the foundation for your prenatal care, ensuring a healthy pregnancy for both you and your baby. Prenatal visits are regular checkups with your OB/GYN, provider, or midwife that occur throughout your pregnancy. Prenatal visits usually occur once a month until 28 weeks, once every 2 weeks from 28 to 36 weeks, and then every week until you deliver the baby. However, the frequency may change if there are complications in your pregnancy that your provider or midwife need to monitor more closely. These appointments are also meant to help establish a trusting relationship with your provider so that you can feel confident about the pregnancy and delivery process. You and your provider should work together to answer any questions you may have and provide evidence-based information to help you make informed decisions. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. There are specific disparities faced by pregnant people in Wisconsin, too. In 2023, about 1 in 25 infants, or 4% of live births, were born to a person receiving late or no prenatal care, and about 1 in 9 infants, or 10.9% of live births, were born to a person receiving inadequate prenatal care. Inadequate prenatal care among births to pregnant people under 20 was about 3 times higher among birthing people ages 30 to 39. Between 2021 and 2023, Indigenous parents, 22.2% of birthing people, had the highest rates of inadequate prenatal care compared to other maternal race categories. Prenatal care can be the difference in problems with your pregnancy being spotted early. By engaging in prenatal care, you can improve your chances of a healthy pregnancy and birth outcomes. Between doctor appointments, keep track of your symptoms. Many symptoms such as nausea, vomiting, fatigue, and swollen breast tissue are perfectly normal during pregnancy. However, there are many signs and symptoms pregnant people need to monitor. This could include a headache that won't go away or gets worse over time, dizziness or fainting, changes in your vision, fever of 100.4 or higher, extreme swelling of your hands or face, thoughts of harming yourself or your baby, trouble breathing, chest pain or fast beating heart, severe nausea and throwing up, severe belly pain that does not go away, baby's movement stopping or slowing during pregnancy, severe swelling, redness, or pain of your arm or leg, vaginal bleeding or fluid leaking during pregnancy, heavy vaginal bleeding or discharge after pregnancy, and overwhelming tiredness. If you experience any of the following at any point in your pregnancy, contact OB triage immediately or call 911. Monitoring your pregnancy symptoms is important because it ensures both your health and your baby's well-being. Being aware of changes can lead to early detection of complications, help your doctor adjust care as needed, and provide you peace of mind knowing what is normal versus concerning. You can keep a journal, or there are many interactive mobile apps you can download to track your pregnancy. It is also important to stay active during your pregnancy. You can search for pregnancy-safe workouts like prenatal yoga, walking, or light weightlifting. The general rule of thumb is anything you are doing before to stay active is safe to do while you are pregnant, but always check with your provider first if you are unsure. Keeping up with your activity can help you avoid postpartum conditions like diastasis recti, ab separation, and pelvic floor dysfunction. Plus, stretching can aid in reducing tearing during labor. No matter where you are in your journey, Security Health Plan wants you to feel informed, prepared, and empowered. Learning the first steps to take after confirming you are pregnant can establish healthy habits and connections with a provider or care team. In the next video of our series, we'll talk more about maternal health disparities in Wisconsin. We'll define health disparities, explain their causes, and provide important data.